If no one operates on him, he will die. If he operates, he might die anyway, and in the frozen isolation of Antarctica. There was only one surgeon left alive, so he sterilized his tools, sat down, and cut into his own body. In the most remote place on Earth, surrounded by ice, isolation, and absolute silence, a young doctor prepared to cut into his own body to save his life. It was 1961, deep in the frozen wastelands of Antarctica, where a Soviet research base sat buried beneath blizzards and darkness. Outside, temperatures plunged to minus 60 degrees Celsius, and winds screamed across endless ice. Inside the station, 12 men huddled together for survival. Meteorologists, engineers, pilots, and their only lifeline was a single doctor. Dr. Leonid Rogozov, just 27 years old. Then one night, Rogozov began to feel it. A sharp pain in his abdomen, nausea, fever, weakness. He recognized the signs instantly. He diagnosed it countless times before: appendicitis. But this time, there was no hospital, no surgeon, no rescue plane. The nearest help was over 1,000 miles away, and violent blizzards had grounded all flights. As the pain worsened, Rogozov realized the horrifying truth. Within days, he would be dead. His only chance of survival depended on someone removing his appendix. And since he was the only doctor on the entire continent, that someone would have to be himself. Trapped at the end of the world, with death closing in, Dr. Leonid Rogozov made the most terrifying decision a human being could make: to become his own patient. Antarctica, a place so cold and unforgiving, even time itself seems to freeze, was now the stage for one of the most impossible medical emergencies in history. It was April 1961 at the Soviet Novolazarevskaya station, a small outpost buried beneath relentless snow and wind. Supplies were scarce. Communication was unreliable. The nearest human settlement was over 1,000 miles away. For months, the 12 men stationed there had endured darkness, storms, and isolation. Their only comfort, the routine of daily work and the steady presence of their doctor. But that routine shattered when Rogozov felt a dull ache in his lower right abdomen. At first, he dismissed it. Within hours, the pain sharpened. His body weakened. Fever set in. He didn't need a second opinion. Acute appendicitis. And if it ruptured, infection would spread through his abdomen. Death would follow within hours. Outside, the blizzard howled against the steel walls of the base. There would be no evacuation, no rescue, no surgeon. The men around him could only watch, helpless. Rogozov understood what no one dared to say out loud. The only way to survive was to operate on himself. And as the Antarctic wind screamed through the night, he began preparing for the unthinkable, a one-man surgery at the edge of the world. With every passing hour, the pain intensified, and Rogozov knew that waiting any longer meant signing his own death certificate. By the third day, his fever climbed. His pulse weakened. Standing became difficult. His colleagues begged him to rest, but he knew rest would kill him. He wrote in his journal his handwriting trembling. "I have no one to turn to. If I don't operate, I'll die. It's that simple." Evacuation was impossible. The radio crackled with static. Help was days, maybe weeks away. So Rogozov made his decision. He would perform his own appendectomy. He prepared the small medical room. Instruments were sterilized in boiling water. Antiseptics lined the counter. 2 colleagues, a meteorologist and an engineer, were instructed to assist, not as surgeons, but as hands to hold a mirror, adjust lamps, pass tools. He injected himself with a local anesthetic, knowing it would dull the pain, but not erase it. One mistake could puncture an organ he couldn't reach to repair. Under flickering light, Rogozov positioned a mirror above his abdomen, took a deep breath, and lifted the scalpel. And as the blade touched his skin, the unimaginable began. A surgeon performing surgery on himself, fighting time and death in the loneliest place on earth. Under the dim yellow glow of a desk lamp, Dr. Leonid Rogozov made the first incision into his own abdomen. The room was silent except for the wind outside. His assistant stood pale and trembling, terrified to make a sound. Using only local anesthesia, Rogozov worked slowly. The mirror reversed every movement. Left became right, right became left. After minutes of disorientation, he abandoned the mirror entirely and began operating by touch alone, guided by pure anatomical memory. Blood pooled on the table. His gloves grew slick. His body trembled. At one point, his hands went numb, and he wondered if he would lose consciousness before finishing. Several times he stopped, barely breathing, his vision fading. He injected more anesthetic and whispered instructions through clenched teeth. Nearly 2 hours later, he found it. A swollen, infected appendix, moments from rupture. With fading strength and steady resolve, Rogozov clamped, cut, and removed it. He disinfected the cavity, applied antibiotics, and stitched himself closed in 3 precise layers. When it was over, he leaned back and whispered, "It's done." Then he collapsed into exhausted sleep. And while the men around him watched in stunned silence, no one knew whether the operation had saved him or merely delayed the inevitable. For hours after the surgery, the station remained silent. When Rogozov finally awoke, his skin was pale, his pulse weak, but the fever was gone. The next morning, he checked his own vitals. By the 5th day, his temperature stabilized. By the 7th, the incision began to heal. 2 weeks later, he was back on duty, walking, eating, treating patients, as if nothing had happened. When the story reached Moscow, the Soviet press called him a symbol of courage and discipline. Medical schools studied his case. Photographs of his self-operation became icons of human endurance. In the harshest environment known to man, Rogozov had turned certain death into proof of survival. Dr. Leonid Rogozov's story isn't just about survival. It's about the moment when human resolve meets the impossible and refuses to break. Alone at the end of the world with no help coming, he turned fear into focus, pain into precision, and isolation into action. Years later, when asked about it, Rogozov said simply, "A job had to be done. I did it." No heroism, no drama, just survival. And if one man could survive surgery on himself at the edge of the earth, then the next story raises an even stranger question. What happens when someone lives an entire life without ever feeling pain at all?